Good morning, Peter Goertz. I'm a psychiatrist. Do psychiatrists hear unusual things? If you're training to be a psychiatrist, are you ready for what you're going to hear? If you're a medical student wanting to be a psychiatrist, are you ready to hear a variety of things that are quite strange sometimes, bizarre sometimes, and sometimes they can be humorous? And of course, not every patient is always telling the truth. And unusual things that we hear as psychiatrists can be facts that are just unusual. They can be lies. Like the other day, a patient of mine, he came in with an alcohol level of about 250, but he was telling me he only drank 1 or 2 cans, small cans of beer per day. So most likely not true. And unusual statements can be due to psychosis, of course, dementia, delirium. They can be of a factitious nature, so people can make bizarre statements because they want to be in the sick role, either mentally or physically. So someone might say, they have blood in their stool and it's not correct, they just want to be a patient, or that they're hearing voices and they just want to be a patient. So as usual, as psychiatrists, we want to keep an open mind. And in general, even if things sound bizarre, we want to remind ourselves for the patients, there most likely is a serious aspect. They're suffering in some way. And at the same time, we want to have a sense of humor. We want to be a human being, and sometimes we just need to laugh because things are bizarre. And that does not mean that we're laughing at the patient, but sometimes things can definitely blindside us. At least for me, that's happened. So another thing that I've heard from a patient was what sounded like an experience with a UFO and extraterrestrials. And again, we want to be open-minded. Who am I to say that that cannot happen? And with this particular patient, she was not trying to push it in my face. It only came out after I asked her in detail about her history, and then she gradually started talking about it. She didn't want to think about it. So in this particular case, I'm open to the possibility that it actually happened. And there was a psychiatrist, Dr. John Mack, actually, who spent a lot of time addressing this issue of UFOs, aliens. And another example of something that I missed, or something that was tricky, was a patient who I thought was paranoid. She'd been hospitalized, I think, once before on a psychiatric ward. And it was the second time I had her as a patient, and she kept on saying her neighbor was harassing her. And she said he even put a video camera into her apartment and was observing her. And we want to be humble, because what turns out actually is that neighbor admitted to harassing her at all hours of the day and night. However, there was no video camera in her apartment. So she was partially telling the truth, what actually happened. Partially, though, she was delusional. So it can be very tricky. And as usual, as psychiatrists, we can be humbled, and we want to be humble because there's no place for arrogance. We can all make errors, and that happens frequently, to me at least. Another patient I remember, he did not seem psychotic, but he may have been a gentleman with PTSD who was at the VA many years ago, and I talked to him in the morning, and he said, last night my wife, who was deceased, came to him and they had sex. So this could have been some kind of spiritual experience. He did not seem psychotic, like I said. So again, we want to be as accepting as possible and as open-minded as possible. Another patient I saw was telling me the government was trying to kill her. And things like that are possible. So again, there could even be a combination. Maybe the government was trying to kill her, but certain things she mentioned might have been delusional. Another interesting example was a lady who came into an urgent care clinic where I was working at the time. And she, in the waiting area, I think she may have had a seizure. Did not seem to be an epileptic seizure. It may have been a psychogenic seizure, so due to stress. And she had 2 children with her, and she was saying things that were quite bizarre, including that her young children, maybe ages 8 to 10, were driving her car. And the children actually confirmed that. I'm not sure how. I don't think I spoke separately with the children. She may have just said that, and the children just said, yeah, we do. So that's something that one might call a folie à trois. There's a folie à deux when 2 people believe something that's delusional. One of them is buying into something that the delusional person is saying. And in this case, it seemed like 2 young children might have been buying into what the patient was saying, namely that they were driving when they weren't even tall enough to physically be able to drive, from what I recall. Another patient, another example, this time a schizophrenic patient. A medical student was talking with him, and I was with the medical student, and this was the first evaluation, first day on the ward. And the medical student asked him something like, how did you end up in the hospital? And the patient immediately started talking about an orchiectomy, so a resection, surgical removal of a testicle, just out of the blue. And that did blindside me. I was not expecting that. I did laugh because it was just so out of the clear blue sky. And the medical student, to his credit, stayed stone-faced and just continued the interview. And I think that's part of what made me laugh at the time. And again, if we're laughing, that does not mean, in my opinion, at all that we're being disrespectful intentionally to the patient. It's just sometimes we get blindsided. And I think humor can be actually a sign of respect, that we respect the patient and feel the patient may have a sense of humor also. In this case, though, the patient did not laugh. So he was really focused and serious on having had an orchiectomy, which was not true, by the way. Another patient told me that he had blood in his stool, and also was hearing voices. He'd been diagnosed previously with schizophrenia. But when I talked with the sister said, no, he doesn't really hear voices. He doesn't really have valid physical complaints in general, but he just likes to be in the hospital, likes doctors to think he's sick mentally and physically. So it turned out that the gentleman probably had factitious disorder, and I still thought he was dangerous in the sense that he'd had multiple surgeries, abdominal surgeries, because of factitious complaints. And I wanted him to stay in the hospital, but he actually requested to go to court. There was a court in the hospital where I worked, and the judge released him. So it can be dangerous to have factitious disorder, of course, undergoing surgeries, and then you can start having real physical complaints, consequences of surgeries, of course. Another patient that was hospitalized, I think for a psychotic episode, and it may have been drug related, but when I talked to the sister, she was telling me that he'd acted really bizarrely, climbed on top of a car, was masturbating on top of the car in public. So again, a lot of unusual things that we hear. Another patient, when I was a resident, it was actually not my patient, but another resident told me about the patient, and the patient had presented to the emergency room dressed all in black leather with a dildo inserted into his rectum in a manic state. And that particular resident evaluated that patient at the time. And again, so pretty unusual situations that we can see as psychiatrists. Now, people can also tell you, for example, that they killed people, which may or may not be true. I remember one gentleman whom I evaluated in an emergency room, and he was telling me basically his history. And then we came to, I asked him about maybe if he'd ever thought of killing anybody. And he said, well, once I killed a prostitute. She, for some reason, angered him maybe. And he just said it kind of on the side. And this had happened years ago, as per him. So you never know what you're going to hear from patients. And in that type of situation, we do not have to call legal authorities because this happened years ago. If he were to tell me, now I want to go out and kill someone, that's a different story. Another patient, he had been admitted to the hospital in a manic episode, and he told me that years ago he was visiting a city and woke up in the morning, and he told his friend, I had this strange dream last night that I was running through the street of the city naked. And the friend looked at him seriously and said, that was not a dream. So again, we hear various things. And if you're training to be a psychiatrist, or if you're a medical student wanting to be a psychiatrist, you do want to realize that you will be hearing and seeing a lot of unusual things. And you want to be, as much as possible, emotionally prepared for it. And again, have an accepting, open-minded attitude. Thank you.